every last one of us has a history of trauma, whether not direct trauma or indirect trauma.
A lot of people do not accept that there's a lot of trauma in Sierra Leone. It's a lot of denial. Me no ever tell you say I traumatize you.
You see a lot of aggressive behaviors, a lot of anger in people there. Somebody go sit on me, move the water, they go, why you move me water? What's happening? They begin all kind shire, if you would, because they move the water, but the issue not to the water.
And the automatic description can usually be either craze or this person ignore the.
To be empathetic, how they describe them, because if like you don't picking, you don't want to let somebody say you picking craze, or you picking it not full up.
Welcome to Honestly Speaking, the podcast where we have conversations about issues shaping our lives. I'm your host, Antonia Howard, and today we're talking about mental health. Joining me on the podcast this morning is Dr. Carol Labour. She is someone who has worked at the intersection of clinical, public, and community mental health, and currently she is the National Advisor on Mental Health in Sierra Leone. Welcome to the podcast, Dr. Labour.
Thank you for having me.
I'm really glad to have this conversation because in Sierra Leone, mental health has, I think it's becoming more of a conversation, especially with the recent surge in drug use, drug addiction, drug abuse. And so some of the points that we would talk about today are related to that. But I think a good starting point would be based on, say, our history, all the things that we don't go through as Sierra Leoneans, from the war to Ebola to COVID, public health crises, just economic instability as well. How would you say the current state of mental health in Sierra Leone is, based on how we live, how we work, how we relate to each other?
Thank you again. Thank you for your questions. When you look at the state of mental health in Salon, we're not going to begin from today. We're not going to even begin from the war, because oftentimes when they talk about mental health and especially trauma, we can always reference the war. But trauma in this country predates the war. Remember, say, first we were a colonized nation. And so we're still going through the decolonization process. You had slaves that returned, slaves that were taken, slaves that returned. All of this is intergenerational trauma where we don't experience for a long, 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 long time. And so one of the things that with trauma is handed down like a tradition. Even where women get belly, if you don't experience trauma, it pass the trauma down to an unborn picking, which is called epigenetics. So just imagine the picking that now, just the fast forward where you're talking about Kush, they've all had a traumatic experience. So when you talk about the state of mental health in Sierra Leone, I want to say, this is just off the record, nothing statistically speaking. I want to say every last one of us has a history of trauma, whether not direct trauma or indirect trauma. And oftentimes trauma and mental health are comorbid, they exist together. So I would say for the country, there has not been a national survey since after the war. And I believe after the war, there was a high percentage of individuals don't get trauma, of course, sexual, gender-based violence, women and girls, individuals that lost limbs, individuals who lost their life, families who lost their people, them, picking that we lost their mama, papa, things of that nature. So there's I want to say there's a high rate of mental health issues. That doesn't mean it's someone we're going to meet the clinical diagnosis of a mental health disorder or a mental health condition, because somebody can get depression, somebody can get anxiety, but they reach the level for actual clinical diagnosis.
I just wanted to ask about that because, Santana, because of the stigma we attached to mental health, a lot of people do not accept that There's a lot of trauma in Sierra Leone. In fact, one of the episodes that I did with Edeline Elba is one where she says Sierra Leoneans are traumatized. But if you see people's responses to that, it's a lot of denial. Me no ever tell you say I traumatize. Me not traumatize. Would I tell you say I traumatize? But then when you look at what trauma is,
Yeah.
if you understand what it means, you would see that that is indeed true. So how does that show up? How trauma they show up in we own society?
So trauma, when it comes to trauma and people, then it's an individual experience, but then you also have the collective experience, collective trauma. Just like we did talk about the war, in the experiences maybe don't happen before the war, after the war, COVID, mudslide, Ebola, even Mpox now, and the Kush emergency. So trauma shows up in different ways. Trauma can affect we feelings, we emotions, we behaviors. Oftentimes you will see when somebody they act out, say if picking they act out or adults they act out. One of the underlying questions we before don't explore is their history, the experiences, direct or indirect. Because again, trauma, mental health conditions, someone can have indirect exposure to it. And so the way that I see trauma shows up historically in Sierra Leone is through aggression. You see a lot of aggressive behaviors, a lot of anger in people. Then somebody go sit on me, move the water. They go, hey, why you move me water? What's happening? They begin all kind shire, if you would, because they move the water. But the issue not to the water. So really getting to the root cause of the behaviors where people that exist, the root cause of the issues that we exist in Salon is a way to look at how trauma shows up. It shows up differently for everyone. Some people can be traumatized to the point where they're quiet. They talk. They don't have any facial expressions. Some people can have exposure to trauma where now you see them and them they're aggressive. Some people can have just I mean, again, it's different from everyone, but again, as a community, as a country in Sierra Leone, the trauma you can see the trauma, you can see the effects of the war is still continuing. Why is that? We have never truly dealt with the trauma caused by the war. We have not dealt with the trauma caused by subsequent issues, COVID and the mudslide, Ebola, where people have been displaced, people have lost their lives. Again, the communities that we live are a reflection of us as individuals.
When you say we haven't dealt with it, this is something that is sometimes arguable. Then go say, for example, for the war, there was the Truth and Reconciliation Commission. There was a whole process that Sierra Leone went through. Even for Ebola or the mudslide, there were some sort of support given to individuals, family members who lost loved ones, who lost properties, people that we lost their house there. Some people were relocated. So the idea that we really haven't dealt with those issues, people don't see it that way. So when you say we haven't dealt with it, what exactly do you mean, and how can we deal with it?
Right. So the things that you described is what we would call psychosocial support in ensuring that individuals have a place to live, individuals regain some sense of normality. Now, when I say we haven't dealt with it, that doesn't mean we don't deal with them at all. Of course, there was a lot of work done through the TRC. And even now, what we're exploring is implementing the recommendations from the TRC report as it relates to mental health and psychosocial support. Because I'll take the issue of the war where they dealt with people then that were displaced, even disarming the individuals. And so dealing with trauma from the psychological aspect, dealing with mental health is not a one-off. it's a journey, so we all get we own journey where we they live with all man they deal with mental health, good, bad, or indifferent. And so what we want to do now is to build sustainable systems that address the trauma, the historical intergenerational trauma, and then also prevent future traumatization, because individuals can experience adversity. So trauma is just a fancy word in some cases for adversity, but it's really the experience and the effect of how trauma affects someone. And so, in dealing with it, I believe we have to come together as a nation to address it in terms of raising awareness what it is, so that people are aware. Today, matter of fact, is World Self Awareness Day. These different holidays come up, if you would, or days of recognition come up, and it's self awareness. So, where do we begin as Sierra Leoneans at? To be aware of what trauma is. Because somebody, where you don't explain to them, really don't do psychoeducation, you don't explain to them what trauma is, they may say, I remember that 10-day where this happened. And from that 10-day, na so and so I dey do. Before this thing happen, na so I been there. Oh, when this Tiaka meets me, na so I dey now. So really bringing awareness, education about what trauma is, and let we help people then for learn how to cope with the trauma. Not all my way experience trauma will have adverse reactions, adverse effects. But individuals where the trauma has impacted their ability to live, love, and laugh, we as a nation, we as a government have the duty to teach people how to cope with trauma. We can live with trauma. We live with trauma now. We live with a lot of negative effects from trauma. But how do we increase coping skills, coping strategies at a national level? So we go up, we country for heal. When we talk about heal, people can always say, oh, it's not healing. We all don't heal.
I go heal na heaven.
Yes. Let's go heal that heaven. So it's really how we heal. And healing doesn't mean everything is going to be perfect, because even the healing journey is something that's individual and collective. Where would they look at ourselves as a nation? Where would they look at ourselves as a community, as a family, as individuals, and how would they relate to ourselves?
You talked about the effects of trauma, or basically how it shows up in our in contemporary Sierra Leone as it is now. And I want to maybe tie that to what's happening today in terms of drug abuse. If you were to give a diagnosis of what the problem actually is and why so many young people find themselves in that situation, what would it be?
First, I would say there's been a lot of awareness raising on what drug addiction is. And you see now that because of the awareness raising, people that are able to identify with different sizes, symptoms, to see, oh, so ten this person dip on drugs, so ten this man dip on drugs. If you look at take a whole of society approach, the issues are many. The issues are many, as been said before. And so some individuals, they're not able to cope. I had to go back to the experiences, epigenetics, individuals that experienced the war. If you take, say, the median age of young people that now, say, let's say maybe 25, 30 years, then young people that now, they were born either before, during, or after the war. And so when you talk about human development, it's the very critical stage for picking them, the 0 to 10, from birth to 10 years old. That's when a lot of development happens. So there's a lot of individuals now, say they're born before the war. I would say it's childhood interrupted for a lot of them. The childhood has been disrupted by trauma, by the war, by Ebola. And so now when you have individuals that use a drug, substance abuse, or even alcohol as a coping mechanism to cope, Now, not to forsay all men, we teen don't meet them, they on drugs. Some individuals are genetically predisposed to addiction. That means it's on 10 down your genealogy, down the history of your family. Someone was addicted. And again, these things are passed down. Genes are passed down. Because picking born today, you say, oh, this picking feel by mama. Oh, this picking feel by papa. But we don't talk about the traits. We don't talk about the genes handed down. We don't talk about the personality disorders that are handed down. We don't talk about the traumatic experiences that are handed down. So when you take a collective look at the different issues where they face youth, some youth, because you have some youth that are very progressive, but then you have some youth that are not. And so when you look at the issues where they face the youth, how do we support them? One, through rehabilitation, and that means they're going through detoxification, but how do we also support them through recovery? After they don't come on, whether or not the psychiatric hospital or the rehabilitation homes, the way the government don't set up, waiting at the continuum of care, where they come out there, how we they help them, whose side they go able go. Because when you talk about rehabilitation for addiction, part of the recovery journey is where somebody they learn how to manage their urges. Because you go say, I stress. Somebody go say, I stress, la go gym. I stress, la go run. I stress, la smoke. Stress, I don't stress, la go drink. So all man getting different ways of coping. We not go say all man, say if not economics or even trauma or abuse on my way don't experience their things and could they on drugs. So it comes down to yes, the individual, but then also the society that they have been born into, the experiences. Just imagine, oh my, you don't born you picking water happen. So what did not happen to this picking now? What did not happen to you? Where you go run that bush, do different things there for survive. So a lot of individuals are in survival state, in a state of survival. Not today no more. We remember for today, we don't remember for tomorrow. Because the instinct, the humanistic instincts have kicked in now and we're in survival. So as a country, as a community, as a nation, how do we move from survival to a place where we thrive? And where you thrive, that don't mean say all okay. That don't mean say you get all the money, because you go look even now, na America, around the world, people that millionaires, they're hooked on drugs. Millionaires are overdosing on drugs. And so again, we have to look at the cause and the effects. Again, you talk about genetic predisposition. You talk about early childhood experiences, which is called ACEs. You talk about relational experiences. How we dey relate to my mama, how we relate to papa. We papa been there, we mama been there. Sometimes papa there, but care. Because now in our society, the awareness about mental health, our feelings, our emotions are coming out.
I just wanted to ask about that, about the awareness, just generally speaking in Sierra Leone, whether it's there, whether it's growing, or there's still a lot of stigma attached to it. Yes, there's stigma, I know that, but from what I see, in my opinion, and you may have a different viewpoint on this. From my opinion, it's like there's more awareness about mental health issues, mental health problems. And I think structurally or policy wise, there's some growing support when it comes to mental health in Sierra Leone. But what would you say? Is there still a lot of stigma? What would you say about that in Sierra Leone?
I would say stigma exists around the world. And so not to just salon issue, not to salon no more they deal with mental health, not to salon no more they deal with drug addiction. As a government, just having different structures in place, Kissy Psychiatric Hospital, the different rehabilitation centers for support, the Kush recovery, the Kush crisis. But then you will also take a look at America. America don't they deal with drug addiction since, I believe, the 1940s. So addiction, that's something we deal with. Then at the Bible, then at the Quran. So not all not all something will just happen. I believe it was silent. You go get different issues where they come up, pampas, tramadol, but I think the physical effects of the Kush crisis, coupled with the psychological effects, is really at the forefront because now not all person just know they take drugs. They develop so food, develop organ failure, different things. And so when you talk about stigma, I would say yes, stigma exists, but also there's a lot of awareness raising that has happened. There's a lot of individuals now that are talking about their own personal struggles with mental health challenges. Um, as a society, we're really taking a look at how we deal with mental health, how we deal with addiction, how we deal with trauma. And I believe with my appointment in 2022, it really speaks to Sierra Leone as a whole and the vision for His Excellency the President on addressing mental health issues. Because I'm the first person to ever serve in this role to be appointed to lead on mental health, and that doesn't mean I mean no more to do because you have even now at the Ministry of Health you have Drs. Jallo and Dr. Kebi, that's at the Directorate of NCDs and Mental Health. At the Ministry of Social Welfare, you have Ansu Kone, the Director of MHPSS, which is Mental Health and Psychosocial Support. You have in the Directorate of Gender, even Education, individuals. So we all they do with small parts. This is not a one person work. But we all, because the amount of people that where they come on board for address this, it just shows the openness to society for accept say yes mental health issues then they exist in this country, for accept say yes addiction they, for accept say yes help day for we, hope day for we. Even for individuals like me, I've struggled with depression from time immemorial, and I speak of it openly. And I remember the first time I discussed it on social media. They begin call me mama now. What's in do Carol? How don't great Carol? But I just kept at it. And so now when I see people opening up to their struggles, even as women, young women, older women, when you're going through the life stages, different issues that happens to us as women, as girls, different issues that happens to boys and men. It's just amazing to see how we are opening up as a society, talking about mental health, trauma, and addiction, and that serves to reduce stigma.
Yeah, I kind of agree with that. But another question I have is whether, because I think now, because of, say, drug addiction, and people are starting to interrogate why this is happening within the causa, why this person begin take drugs. People are starting to interrogate that, and I think also with the awareness that is going on, the public is kind of building sympathy for people who are addicted.
Mhm.
But there are other types of mental health issues. You talked about anxiety. You talked about depression. There's also different types of disorders. And do you think that those types of mental health issues are getting similar type of awareness or attention?
I would say, in order for someone to be diagnosed, whether it's anxiety, depression, even psychosis, they need a clinical diagnosis. There's various classifications of mental health conditions. So you have the anxiety disorders. You may have individuals that are dealing with paranoia. You may have individuals that are dealing with OCD, obsessive compulsive disorder. So these are some things that we don't talk about in society. It's even when you talk about psychosis, people are dealing with schizophrenia, schizoaffective disorders. That's something where we know they talk about. And so if we were to get into raising awareness on mental health and what we've done and what we're doing, it's really on the bigger, more common mental health disorders that individuals experience. But I think again, just more psychoeducation, more education awareness, then they go really up for let people to understand. And I think one of the things that we're working on now to let people that understand is really to build up the capacity of individuals where they're working with communities, families, individuals, so that they understand what psychosis is, what depression is, just some of the common signs and symptoms, and also for letting diagnose person because left down there to the doctors at Kissy Hospital. But it's imperative that we as a society, where you get people that now, oh man, oh, I did do mental health, I did do mental health, I did do mental health. So when people that can come to me, they can vex by me small because I'm like, okay, what are you doing? Where did you learn? Where did you get your training? What's your background? That doesn't mean for support person you need to be a trained mental health person, a psychiatrist, psychologist, but you need to have the level of understanding on what it is, how to support, and the referral pathways, i.e. the send person. Because you know what, they take somebody today as a project. Oh, this person, they on kush, and they can't help 'em. I go to talk to her, I go to cook some. If not cooks, nobody not go sick. You know what I mean? Because you really, when it comes to addiction, and how we're supporting individuals, it's something called neuroplasticity, retraining your brain. And so for individuals that are addicted to substance abuse, even individuals that are suffering from mental health disorders, there's a level of neuroplasticity that can occur to help them on their recovery path.
Hmm. So one of the things I struggle with as well now, just the language to use
Yes.
when it comes to mental health, because me
Yes.
not I not sabi talk other
Yeah.
I not sabi talk other local language, I not sabi talk Mende, Timini, I not sabi talk any of their language in they na Creole asabi. And the automatic description can usually be either Chris or this person is not there or is not in not too sober,
Yeah. Enough.
So exactly, not too full up.
Mhm.
And
Lau.
those are, kind of not even kind of very discriminatory, derogatory, and just a lot of stigma attached to those descriptions. So how do we how do we approach that?
Mhm. So I believe, when you talked about stigma in the past questions, that's part of it. The shame, because shame of the unknown. Um, I was reading something just the other day, and I believe over 280 million people globally suffer just from depression. So, and I think it's like 1 in 5, or not quote me, or because I know people, the doctor I quote wrong, but
Mhm.
1 in 5 or 1 in 3 women suffer. So it's something that's very common globally and locally as well. And so again, it's about awareness, capacity building. How do we use uh, um, less discriminative words, um, especially when you try to translate, mental health conditions. I don't like to use the word disorder because disorder is it is an implication that something's wrong. So, but you can have individuals that they get mental health disorders, mental health conditions that live relatively full lives, and so really bringing in that empathy for someone. If you see someone that they're suffering, then they struggle, you recognize, say, they're having mental health challenges, to be empathetic how you dey describe them. Because if not you don't picking, you're not gonna want to let somebody say you picking Chris, or you picking it not full up. But I think again, um, just historically, the words that we've used, because we weren't taught, we not be known. But now where we know, the awareness is being raised at various levels across the country. Um, I think it's imperative on us to educate each other. If you hear somebody say, Dande, so and so, well, not to that word they for used. And I believe that would help towards changing stigma, and then also changing the language where we use for describe people then.
Do you think our belief systems whether it's religion or traditions, do you think they help or hinder recovery in just the mental health space?
I believe both. So our belief systems, whether it's cultural, familial beliefs, can help the recovery. A lot of people rely on their faith to go through their recovery process. But then also it's a double-edged sword because you will get belief systems that will hinder recovery, that will hinder individuals for even coming out and saying, "Oh, I just struggle with this." Because remember, mental health issues, oftentimes it's a silent epidemic unless person can tell you or unless you observe some challenging behaviors. But a lot of, even in our society, a lot of challenging behaviors we attribute it to, oh, that's what it did, that's what it left on so. But in order to really address this, looking at the cultural belief systems, because person go say, damn it, I witch the witch na juju, or let we can go to mercy man, let we can to this. I know they say nothing right, nothing wrong. But in order for the recovery process, it's an individual journey. Now, like picking, you go beat picking, say, no mean say you go listen. You go just, okay, you don't adapt. They can't beat me. Let I go on by my way.
And that one can that cool.
Yes.
So
So the same thing with mental health, addiction, and when you bring in the cultural, the stigma, there's a lot of cultural stigma attached to it because person go say, let nobody know say something do me picking, something man no go want me, or me picking something man no go come off for him because they feel say all man are we family Chris. So that culture, that way of thinking, and so really it gets to it's the realization that we have to reshape our thoughts, our attitudes, our beliefs around mental health and addiction.
which group do you think gets left behind or is not usually thought of when it comes to mental health? You've worked in this space for, a good number of years, and you have a lot of experience. And, I find that the conversation on mental health, it shifts depending on what's happening in the country during that period of time. There was a time when maybe 5, 10 years ago, there was a lot of focus on women and girls in terms of gender-based violence or violence against women and girls. And now we're talking about drug addiction. And that kind of focuses on young men or young male in Sierra Leone. So what do you think? Who do we usually not think about when we talk about mental health or even trauma?
I want to say, in terms of left behind, there's an adage in America that says "No child left behind." So I believe, depending on the conversation, depending on the interest of individuals working in the space, depending on the situation at hand, is where the attention goes to. But I don't believe that means anyone is left behind. But how do we support ensuring no one is left behind? Ensuring, say, people that know Usai for go, ensuring that we build a society that can have these uncomfortable conversations and they stay between you and the individuals. I say now, and anyone that wants support, that needs a clinical diagnosis, clinical intervention for mental health condition, they can receive it. You have the Kissy Psychiatric Hospital, but then you have the hospitals in all 16 districts, including Connaught here. So it's not just Kissy, excuse me, that someone can go to. You have mental health nurses that were trained in 2012, I believe, in 2012. You have individuals now that have the capacity, the education, the experience to support and refer. So I don't want to say anyone's being left behind. Again, we don't want to leave anyone behind. And that's why we're taking a collective look at mental health. That's why mental health is not just with the Ministry of Social Welfare. It's not just with the Ministry of Health. It's not just with gender, not just with education, with school counselors. You even now have the National Public Health Agency that's looking at mental health as a public health challenge. We're utilizing a public mental health approach, and that means we're looking at population mental health. Population health is looking at the health of individuals. Population mental health. You're looking at the mental health of everyone, and so we don't want to wait until somebody meets the clinical diagnosis for weights. Say come for letting go see. You start with education, awareness raising. And so that way you're looking at prevention, early intervention. Because you're not gonna see something that go wrong. You say, left found, left found. Intervention. If you see something that happen, this thing, see something, say something. If you see somebody, don't begin, their habits don't change, their hygiene don't change, the way that they behave don't change. If they don't go quiet, all of a sudden having uh, uh, um, outbursts. Hey, Patty man, what's happening? You want to talk? But when you talk, I'm going back to stigma now and not leaving anyone behind. When you talk about stigma, a lot of things that you can attribute to stigma is also gossip. Kongosa, where's the safe space? Who are you to go talk to? Who are you to tell you bellebone secrets where you not get for tell somebody? They say, oh man, paddy, get paddy. So these are one of the things when we talk about stigma, when we talk about addressing mental health, addressing addiction. I don't like for use the word eradicate because, like I say, addiction, mental health, they don't live from in all over the world, time immemorial. And I know say me, outside me sit also today, right now, me not get the capacity for eradicate. I don't believe say anybody get the capacity for eradicate. For go, I begin explain to person, and also I will say, it's on me time, can see what that permeates or it permeates into society, a culture of silence, no talk, let them know. You'll have individuals today that are going through egregious situations there, things that way you not go even imagine, but they're not able to talk. Everything that happen is silent, silent. They want to you just hear you pass off, you take your life, you complete suicide. But that day back we don't talk about it. It happens so often. I hear cases all the time.
As you talk about that, I would just like to, add or reframe the question about some of the things that we do or don't do that are really detrimental to our mental state, just generally as a society. Like you're talking now about the culture of silence and just not speaking up when something is not right.
Mhm. So I'll take America for example. You have ethics, code of ethics, but you also have something what binds you. Um, in having these discussions, you have HIPAA laws in which they exist to protect an individual. If I'm coming to see you as my psychiatrist, my psychologist, it prevents you from explaining what has happened. It doesn't exist here. It doesn't exist. And this is not just a health system. This is for anyone that works in this space. You should be able to have uncomfortable conversations. Um, and someone not fear say you to go tell their secret, you to go tell what's happening. And so the culture of silence is very big in Salon. The culture of shame is very big in Salon. The culture of judgment is very big in Salon. They will say, look this one, look how they dress, look how they talk, all day they make. So people are afraid to discuss what did happen to them. You go see person today. I my focus talking about no one left behind. My focus is always on women and girls because I was a girl. I am a woman, and my inner child still sits with me. Mm? But the culture where we get that shame, you go see person they go through breakup. Breakup. What is breakup? If two people that not agree, let one man go their way. But yeah, in our community, it's a shadow of shame. So pussy go sit down, they go indoor. Woman go indoor, you go indoor. They beat time, then they mistreat time, but you know you will talk. On the flip side, not to say man, woman not they beat man, oh. Man, them back go sit down, they indoor. Because we don't get that openness in our society. We don't get I know we say safe space, they're not there, but they're not boku. We don't have that trust within ourselves in society. Me, I counsel people. People call me middle nets. Call it. They call me the cry. The dandy. But wherever I hear you say, oh, this person, this because you need a safe space. If we're to decrease the culture of silence, not salon, if we're to decrease stigma, where everyone is in a safe space to discuss this, it starts with us. It starts with individuals. It starts with me. It starts with you. I'll end this question with this. You'll see now the generation before us, our mothers, our aunties, our grandmothers, our grandparents. Oftentimes, when they're having conversations, you're like, "Oh, you're describing a whole lot of trauma," but it's something that we've accepted in society and normalized trauma, the adversity that we go through, often at the hands of each other, and we deal with it, but it catches up to you. Because when you talk about the later lifespan, life stages, when you talk about dementia and different trauma-induced, trauma-related mental health conditions that happen in later stages in life, these are the results of unspoken words, unspoken experiences.
Yeah, yeah.
They go deeper.
Yes, I mean it's such a deep issue or topic, and obviously we cannot cover that, eh, cover all of it in the little time that we have now. But you're now the national advisor on mental health. What are some of the things that you are working on now to kind of increase support, awareness about mental health in Sierra Leone?
Uh, we've done a lot. I was appointed in April of 2022, and since then we've put together the Presidential Task Force on Mental Health. And under the Presidential Task Force, you have all the various line ministers and some of the department and agency heads. And so, of course, they're the political head. We've done a mapping exercise of community-based stakeholders. And so these are civil society, CBOs, community-based organizations where they work in mental health to gain their capacity. Um, and surprisingly, doing that exercise, there were 78 organizations that responded and said, yes, they do mental health, and taking a deep dive into what they do, how they do it, where they do it. We now realize we have to also support them in building their capacity because everyone has a willingness to help. I don't believe anyone's doing this work with any malicious intent. So how do we build up their capacity? We're also working on doing rapid assessments. I just returned from Addis with WHO and Africa CDC, and where we're going to do a rapid assessment of MHPSS in emergencies because we're working towards building a sustainable system. Because each time an emergency happens, after the response, the system doesn't get as much attention as it should. And so how do we build a sustainable system where you have in all these MDAs, where you have within the communities people that are trained as mental health responders that can support? We've put together a roster of everyone we've trained. Last year alone, we trained or built a capacity of 1,090 various individuals. These are individuals in multi-sectoral spaces. So whether it's the health workers, the DHMT, the district health management teams, women living with HIV, Kush victims that have come out of the rehabilitation centers, and training them on peer-to-peer support because everyone has a role in addressing this. So the work is a lot.
Beyond policy, because sometimes I think policy is easy, especially if you have leaders who have got the political will. I think that's the easy part. But realistically, what can family, schools, workplaces, individuals, what can communities do to support mental wellness?
So in terms of policy, so my office, we don't work on specific policy. You have the Directorate of NCDs and Mental Health. They're working on the strategic plan, the mental health policy, even the mental health law, and um, which is we're still under the 1902 Lunacy Act, working on repealing and implementing a new law. And so everyone has their role in this. What can families do? What can communities do? Is basically what we're doing at the National Public Health Agency through the Mental Health Secretariat is building capacity. We utilize a training of trainer approach. So it's not for me to go around and do our thing, but once we build that capacity and we have a core group of individuals that can now disseminate the informations and the lessons learned. Because as individuals, as families, education on what the issue is key. Education on what depression is not is key. Education on what addiction is not is key. Because you can have someone that's addicted or uses substances, whether it's tramadol, whether it's kush, whether it's alcohol. You can have someone that uses that's not addicted. So there's a distinction between an addiction, which is a brain disease, and someone that uses. And so, how are we using that psychoeducation? How are we building awareness? How are we using evidence based tools, practices to support families, individuals, and communities is key. You know, you go get somebody go say, "Oh, this do you go wash with salt water, a la this 10 10." Come on. Now, if you believe it, it's not to say it's. I'm not. I don't know. I know. No judgment. We listen, but we don't judge. But at the same time, you do that. But then also, let me show you how best you can up this person this way. How do you train people on emotional regulation? How do you train people again self-aware? Why do I do this? What happens that triggers me to do this? Let people that understand their triggers and how to manage their triggers, how to manage their thoughts, feelings, and behaviors.
All right. Yeah, that's I do think that the conversation and even actions are moving forward. As we round up, the last question I'd ask is, what gives you hope um in Sierra Leone, working in Sierra Leone and doing this work in mental health, in the mental health space in Sierra Leone? What gives you hope about, the trajectory we're taking?
I would say, hmm, hope for me lies within. I'm here. This is a labor of love. A volunteer, voluntarily here to support Sierra Leone because I know it's possible. I know the trajectory as it pertains to mental health and addiction can change. I know the societal views on it could change. I know the perceptions of it can change. And I say that hope lies within because I use myself as a model. I've struggled with mental health in terms of depression and trauma since I was a child. And I really use my own story to give hope to other individuals. And I hope I'm giving hope to Sierra Leone that healing exists. It's an individual yet collective journey. You have individuals at the psychiatric level that can support. But when we talk about recovery and giving hope to the nation, it starts within all of us. How we address each other, how we build trust in each other, how we communicate and have these uncomfortable conversations. I mean, sometimes it's just sitting with your mother or your father or your grandmother and just listening to their experiences and asking the hard questions. What's in be happening? I found out so many things, even about my family going up country and just like, oh, Uncle so and so being jump come on at this bridge, Uncle, just people that I'm like, oh wow, these are things we don't talk about. So hope lies in having these uncomfortable conversations in safe spaces. Hope lies in Sierra Leone continuing to embrace that we are a traumatized nation and yet we are moving towards a healing journey. And hope lies in us in implementing the TRC report as it pertains to building the capacity of individuals to provide mental health and psychosocial support.
Yeah. Thank you so much for your time, Dr. Lieber. As you responded about, hope, where you find hope or where hope lies, it just made me think about this, our identity as a resilient nation. And I'd just like to hear your hear your opinion on that. Because it's a word that's thrown around, and I think at some point we really embraced it, but I think much more recently we don't tire for your resilient. What do you think? Where does that sit?
The big R word, resilient, resiliency. So I think for us as a nation, as a society, we conflate resilience with our hard experiences that haven't been dealt with. So resilience, uh, you've addressed what's happened, you processed what happened, and now you have the ability to go forward. So I believe in a way we are resilient because we do. Sierra Leone, we just keep going and keep going. But then also within that resiliency lies trauma responses. And so, how do we separate the two? How do we address the trauma utilizing a whole society approach so we can continue to move forward and build a resilient nature?
Right. All right. Thank you so much. That word, I think in all of the episodes I've done, that word has come up. And just generally, I think across the board, I've talked about, mental health, ways of thinking, our behaviors. And I think, honestly speaking, one of the reasons this podcast exists is to have those conversations. I don't think the conversation should be the thing that we don't have, because if we don't have the conversation, then how do we know what to do?
Exactly.
And how do we take action? So thank you so much for your time and for
Thank you for having
making
me.
it. Thank you for making it on the podcast. And that's it for today's episode of Honestly Speaking. I hope that you've learned a thing or two from the conversation. But let me know what you think. You can obviously send your comments or just share this conversation with someone, and then maybe that could start up something in your group chat or but we've been recording at Black Lion Production Studio, and I have been your host. My name is Antonia Howard. Until next time, bye.
That's it for today's episode of Honestly Speaking. Thank you for listening and being a part of these important conversations. If you've enjoyed today's discussion, please like and share. And if you're feeling inspired, do leave a review. I'd love to hear what you think. And of course, carry on the conversation online. Share your thoughts, experiences, and ideas using #HonestlySpeakingSL. Until next time, stay curious, stay engaged, and stay honest.